This lecture is a continuation of our lecture on drug absorption. So in this lecture, we are going to talk about the factors which influence absorption from other sites. So within this lecture, we are going to consider what are the factors that influence absorption of drugs from injection sites, from mucous membrane, and from the skin. So first, we'll be looking at factors which influence absorption from the injection site. So there are basically four factors which influence absorption from injection sites. And those are solubility. By solubility, we mean solubility of drugs, concentration of drugs, the local blood flow, meaning the blood flow at the injection site, and the surface area where the injection is administered. So what do we mean by injection sites? So these are the sites in the body where injections are usually administered, and depending on the site, the injection sites are classified as intravenous, intramuscular, and we have other injection sites like subcutaneous, intradermal, and variations of these sites like intraarterial, etc. Okay, so these are the most important ones. Do you remember which are the intramuscular injection sites, which are the muscles where intramuscular injections are given? I'm sure you do, and you're absolutely right. And the important muscles where we give injections are the deltoid, which is in the upper arm. We have the gluteus, and in the gluteus we've got sites like the dorsogluteal and the ventrogluteal. So those are sites in the gluteus muscle, which is basically the buttocks. And then we have the outer thigh muscle, the vastus lateralis. Okay. So this is just for us to recollect which are the most important intramuscular sites. Okay, let's take the factors one by one. Let's look at the first factor which influences absorption from the injection site, the solubility of the drugs. So depending on the solubility of the drugs are formulated as aqueous solutions. This is for injections, okay? Aqueous solutions and aqueous suspensions, and sometimes as oily preparations. Okay? And the rate of absorption follows in the reverse order. Okay? So the rate of absorption from aqueous solution is greater than from that of aqueous suspension, and that in turn is faster than absorption from oily preparations. And because of this, the duration of action of injected aqueous solutions is in terms of minutes. Okay? Whereas aqueous suspensions, they have got a duration of action that's quantitated in terms of hours. But oily preparations, they have got a very, very long duration of action because the drug needs to dissolve into the aqueous fluid which is present at the injection site, and only then does it get absorbed. As a result, oral preparations have got a duration of action ranging from weeks to months. Okay. So let's take an example of a drug where the absorption is over in minutes. Example would be soluble insulin. Okay, so remember, soluble insulin is the only insulin, soluble insulin or regular insulin is the only insulin that can be given intravenously. Okay? All other types of insulin is administered subcutaneously. Okay, so soluble insulin, if soluble insulin is given, say, by the subcutaneous route, and we are not talking about the latest rapid-acting insulin preparations, we are talking about the one which is available worldwide, especially in third world countries. Now, this insulin, if we give it subcutaneously, it is absorbed in about 30 minutes. Okay, so the patient is advised to inject himself or herself 30 minutes prior to having food. Now, aqueous suspensions of insulin they have they are absorbed in approximately 1 to 3 hours. Okay, so they begin to act in this time frame. Okay. Oily preparations. So these we mentioned are long-acting preparations, and so the example would be antipsychotic preparations. Antipsychotic drugs which are formulated as oily preparations. And let's give some examples here. The example could be, say, haloperidol. Decanoate. Okay, so we know this is an oily preparation. And there is felyperidol, palmitate. Okay, so this has got a duration of action of about 3 months. Okay, so these are antipsychotic preparations. And so what's important for us to remember is that depending on the solubility of drugs, they are formulated in different dosage forms for injections. And in these injections, the aqueous solution is most rapidly absorbed compared to oily preparations. And we have given examples of aqueous solutions, aqueous suspensions, and oily preparations as well. Let's take up the next factor which influences absorption from injection sites, and that happens to be concentration of drugs. Now, the rule of thumb is that the more concentrated the drug, the faster is the absorption from the injection site. So, absorption, here we mean the total drug that is absorbed, and the rate of absorption is directly proportional to the concentration. Again, meaning increased concentration leads to faster absorption. But the problem is that when we increase the concentration of the drug, then it can lead to localized irritation. It can lead to local irritation. And that is a problem. Okay, so especially cytotoxic drugs, meaning drugs which we administer for the treatment of cancer. Now, these drugs, with their increasing concentration, they cause lots of local irritation. Consequently, these drugs are not administered intramuscularly. Rather, they are administered intravenously. Okay. But we mentioned that they can cause irritation, and sometimes that may result in phlebitis, which is the inflammation of the veins. We are giving it intravenously, so the veins. It may cause inflammation of the veins, which we call phlebitis. Inflammation of veins. It may also cause, if it is extravasated, by extravasated means it comes out of the veins. Okay, so if you don't have proper injection technique, then the drug in play, instead of going into the veins, would go into the tissues, in which case we call it, we say that it has extravasated. Now, if such drugs get extravasated, they can cause necrosis. Okay, so the point being, at increasing concentrations, some drugs by their very nature may cause irritation, and this is especially true of cytotoxic drugs. Okay? Because cytotoxic drugs have this property, they are sometimes classified as vesicants. Vesicants basically means that they cause pain, inflammation, and tissue breakdown. Okay, which may result in blisters at the injection site. Okay, so cytotoxic drugs, depending on this property, we said it can be classified. They are sometimes classified as vesicants and irritants. Now, what do irritants do? As opposed to vesicants, irritants can cause pain and inflammation, but they do not cause tissue breakdown. Okay, so so that would be the definition of an irritant cytotoxic drug. And then it may be non-vesicants. Okay? But because we are considering local irritation, we won't discuss this further, but let's give some examples here. Examples of vesicants could be um, drugs that bind DNA, could be the DNA binding drugs. Okay. We're talking about cytotoxic drugs. So one mechanism of action of cytotoxic drugs is DNA binding agents. Okay. So drugs which bind DNA, and the example could be the most famous doxorubicin, the anthracycline antibiotic, or the mustard, carmustine. Okay. Or they could be, vesicants could be non-DNA binding, and the example could be the microtubule inhibitor, vincristine, or the taxanes, say paclitaxel. Okay. So those would be examples of vesicants. And irritants, we said that they cause only pain and inflammation without tissue breakdown. And the examples of irritants would be the platinum drugs, let's say an example, cisplatin, and fluorouracil. Okay. So those would be examples of irritant drugs. So what would be the route of administration of these drugs? Yes, because they cause this local irritation, they are administered intravenously. Okay, so why are these drugs, if an example, a question is asked, why are these drugs given intravenously, then you would now know the answer. Okay, let's take the next factor which influences absorption from the injection site, and that is local blood flow. Okay, let's see how local blood flow influences absorption of drugs from injection sites. So the local blood flow is of concern if we think about the intramuscular route or the subcutaneous route. Okay? So the absorption from the intramuscular route is usually greater than the subcutaneous route. Okay? So the reason being, the muscles have increased blood flow, okay, due to increased blood flow in muscles. Okay, so why do muscles evolutionarily have greater blood supply? It's because muscles do work, and for the muscles to do work, they need to contract or relax. And for the muscles to contract, they need ATP, and ATP gets supplied from the blood. And therefore, muscles have got a profuse blood supply. And consequently, if we administer a drug intramuscularly, then it would immediately get into the blood vessels and therefore would be absorbed. The buccal area, if we see a person who has normal hemoglobin, normal blood, if we look into the mouth under the tongue, we find that it's healthy pink in color, and it's healthy pink, healthy red rather, because there is numerous blood vessels, but they are not as perfuse as the muscles, but still there are lots of blood vessels, and consequently we use this route also to administer drugs. Okay. Um, Sorry, but I intended to talk about subcutaneous, and I ended up talking about the um, buccal and sublingual. But buccal and sublingual is given for oral preparations, not for injection. So the point is, subcutaneous route also has perfused blood supply. And when we inject drugs subcutaneously, we gave the example of insulin. Insulin gets absorbed because under the in the subcutaneous layer there are lots of blood vessels. Okay, not as perfuse as that in muscles, but still there are lots of blood vessels, and that's why drugs like insulin get absorbed. Okay? Now, if we can somehow manipulate the blood flow, then we can interfere with the absorption. Now, how can we do that? We can increase the perfusion rate by warming or by massaging the site. Okay? So if we warm or massage, what's going to happen is the blood vessels dilate. Now if the blood vessels dilate, it brings in more blood. As a result, perfusion increases, and therefore absorption would increase. Or maybe exercising the area. Okay, so the idea being that all these interventions that we do can increase the blood flow. So if we want to reduce, what could we do? We could do the opposite. Okay, we could decrease absorption. So absorption is increased by warming, by massaging, and by exercising. So if we want to decrease absorption, if we want to decrease, what could we do? We could decrease by cooling the area, okay? Or in cooling, what's going to happen? The blood vessels are going to shrink, okay? They're going to contract, okay? So contraction can also be induced by drugs, okay? So which are the drugs which can cause contraction of blood vessels? Yes, those drugs are called vasoconstrictors. Okay, do we have examples of vasoconstrictors? We do, and the example would be the epinephrine. Okay, it's also called in opposite side of the Atlantic as adrenaline. Okay, so epinephrine could be a vasoconstrictor, and the other could be vasopressin analogs. Okay, so the commonly used vasopressin analog to bring about vasoconstriction is felypressin. Okay, what could be the application? Usually, vasoconstrictors are given along with local anesthetics. Okay, so let's take an example of felypressin and explain. So felypressin is given along with, say, prilocaine. Okay, so what's prilocaine? It's a local anesthetic. Okay, so what does prilocaine do? It brings about analgesia, anesthesia at the local site. Okay. Okay. Basically, it brings about motor block. Okay. Yeah, so it produces analgesia anesthesia at the local site. But um, if we consider that we are not giving vasoconstrictor, what's going to happen is this prilocaine would go into the blood vessels and then diffuse away from the local site. And that would negate our purpose of giving it in the first place. Now, if we administer it along with felypressin, what's going to happen is felypressin is going to contract the blood vessels in the area that where we injected this combination. And what that's going to do is to prevent the prilocaine from getting into the blood vessels and then diffusing away from the process diffusing away from the site. And so that's the application why vasoconstrictors are given along with local anesthetics. Okay, so the point is we are interfering with the local blood flow and thereby interfering with the absorption. So this is an application of the what we observe what happens physiologically. Okay, so what's the clinical application? It is vasoconstrictors administered along with local anesthetics. Okay, and what's the example there? Right, we have given this example why felypressin is combined with prilocaine. Epinephrine is combined with prilocaine. Okay, so now we know the reason behind that. Okay, let's take the next factor that influences drug absorption from the injection site. Okay, so and that factor is surface area. So the rule of thumb is that surface area is proportional to absorption. Okay, so meaning if there is increased surface area, there will be increased absorption. Okay, so it's directly proportional. Okay, so now this absorption can be increased if we administer. So the absorption is increased if we administer the drug with hyaluronidase. Okay. So if we administer drugs along with hyaluronidase and administer it through the subcutaneous route, then we can increase absorption. Let's give an example where it's done. Okay, so we have this, say, we want to administer isotonic saline along with dextrose. Okay, so let's imagine the patient cannot be given fluid orally. Okay, and what could be the reason why the patient might not be able to take fluids orally? Okay, if the patient has got maybe, let's say, cognitive impairment, or the patient is having nausea and vomiting, or the patient has some kind of an infection, or maybe an abdominal obstruction, maybe, or maybe the patient has had a cerebrovascular accident. Okay, maybe the patient has stroke. So presumably people in the care homes, okay, or in palliative care, okay, meaning geriatric patients. Okay, so in such patients, and you don't want a very fast rate of infusion, then in such patients, this drug can be administered along with hyaluronidase, and it can be given, this combination can be given subcutaneously at different sites like the chest or usually the abdomen or the thighs or the upper arms. Okay. Can be given subcutaneously at these sites. And when we do this kind of an intervention, it is technically called Hypodermoclysis. Okay. So by hypodermoclysis, we can theoretically increase the surface area of absorption at these sites. So what's hyaluronidase doing basically? So what it does is it decomposes hyaluronic acid, okay, in the tissues, and what that does is it decreases the viscosity of the tissues, and by doing that it increases absorption. Okay, so in effect it increases the surface area is what we are coming to at the end of our discussion on hypodermoclysis. Okay, so we have been talking about the factors which influence absorption from injection sites, and we have seen that there are mainly 4 factors which influence absorption from the injection site. Okay, and what are the 4 factors? The solubility of the drugs, the concentration of the drugs, the local blood flow, and the surface area. Influencing the absorption from the mucous membrane. Factors which influence absorption from the mucous membrane. So let's write it down here. By mucus, so what do we mean by mucus? Let's see what is mucus. Okay. So mucus, chemically, it's basically a hydrogel, and this hydrogel happens to be made of mucins and lipids and some proteins. Okay. So what are mucins in turn? Mucins are basically high molecular weight glycoproteins. Okay. Glyco meaning it's got a sugar moiety, and whenever we have a sugar moiety, it's got the propensity to absorb water on it. So that's why mucous membranes tend to be wet. Okay? So when we say mucous membrane, we mean the mucous membranes in the in the nose, the nasal membrane, we mean the one in the oral cavity, and in the lungs, which is the pulmonary mucous membranes, the rectal mucous membranes, and the vaginal. So when we say mucous membrane, we refer usually to to either of this: the nasal mucous membrane, the oral mucous membrane, the pulmonary, the rectal, or the vaginal. Okay. So, why are drugs injected into the mucous membranes, or administered at the mucous membranes? It's because mucous membranes have got this cool property, and the cool property is that they bypass the gastrointestinal first pass metabolism. Okay. So this is the reason why drugs are administered into the mucous membranes. The advantage is that the drugs, after absorption, would bypass the hepatogastrointestinal first pass metabolism. So what is that? So what is first pass metabolism? It is because if we give it by any other route, say the oral route, if we administer something by the oral route, it gets absorbed, assuming that it is a drug which is not highly lipophilic, then it gets absorbed into the blood, and through the hepatic portal system, it goes into the lungs. Not the lungs, the liver. It goes into the liver, and in the liver it undergoes metabolism, and then the metabolite or the drugs which have not undergone metabolism reach the blood, and those metabolites or the drugs themselves are responsible for the action. Okay? So if there is a drug that undergoes extensive metabolism into a metabolite that is inactive, then what's going to happen is the free drug that is supposed to cause the effect will never reach the blood. So we say the bioavailability of such drugs are very low. Okay? So if we have drugs which undergo extensive hepatic metabolism, then this could be an option. So if we give it through the mucous membranes, it will bypass the liver, and more would be available in the blood. So that is one of the reasons why drugs are administered through the mucous membranes of the nasal cavity, the oral cavity, the pulmonary system, the lungs, the rectal organs, and the vaginal cavity. Okay. So usually the drug should have certain properties which would make them amenable to be absorbed through this mucosal membranes. The overriding one being that it should be small molecules, meaning it should be less than 1000 daltons. Okay. Okay. So drug transfer through the mucous membranes, it depends upon the area. So it's proportional to the surface area, the blood flow, and it's directly proportional to the lipid solubility of the drug. Okay, so absorption from the mucus is directly proportional to the surface area, it's directly proportional to the blood flow, and it's directly proportional to the lipid solubility of the drug. Okay, let's look at some examples. Let's take this one by one. Let's look at examples of drugs which are absorbed from the nasal mucosa. Okay. So we have drugs which are, say, gonadorelin, analogs. Okay, so gonadorelin analogs in turn, they are basically hypothalamic hormones. Okay. And the specific example would be basorelin, estradiol, and nafarelin. Okay. So estradiol and nafarelin, we know it is used for the treatment of endometriosis and infertility. Okay. What about basorelin? Basorelin is a treatment option for prostate cancer. Okay. So if these drugs are administered through the nasal route, then we can ensure that it has increased bioavailability because it bypasses the liver. Okay. Okay. So let's look at examples of drugs which are administered through the mucous membrane, the oral cavity. So the most important routes in the oral cavity are buccal and sublingual. Okay, buccal meaning through the cheeks, and sublingual meaning under the tongue. And the most important drugs are nitroglycerin. Okay? So this is also called glyceryl trinitrate or trinitroglycerin. Okay? Nitroglycerin and another type of organic nitrate could be isosorbide dinitrate. Okay, so these drugs are organic nitrates and are given to dilate the blood vessels. Okay. So in case there is reduced perfusion of the muscle of the heart, which may lead to angina. Okay? In such cases, these drugs are administered through the buccal or the sublingual route. So if we give it through the oral route, then it's going to go into the liver, it's going to get degraded, and in addition to taking time, there is also decreased bioavailability. So if we give it through the oral route, preferably through the sublingual route, it gets immediately absorbed into the blood vessels in the submucosal layer in the sublingual cavity, and then it directly goes into the systemic circulation bypassing the liver. Okay, so okay, let's look at the other one, which is the examples of drugs which are administered through the pulmonary mucosal membranes. And the examples would be the drugs which are administered. They are administered using different dosage forms like aerosols, dry powder inhalers, okay, or nebulizers. Okay. So DPI is dry powder. And aerosols, we are familiar with all the anti-asthmatic drugs like corticosteroids, okay, which are controller medications in asthma. Corticosteroids, so let's take another class, maybe something given for migraine. What could be an example? The example could be the triptans, okay? Sumatriptan. Okay, so the triptans, they are administered as aerosols. In this case, for the systemic effect for the treatment of a migraine. Let's look at other examples of which are given as dry powder inhalers. And here we can take the most famous anti-asthmatic drug, salbutamol. Okay, there are some drugs which are administered as using nebulizers, and let's take a drug which is given for COPD, the enzyme, okay, Dornase alpha. Okay? It's administered for COPD, and salbutamol, anti-asthmatic. Okay. Sumatriptan is given for the treatment of migraine, and this is a controller drug in asthma. Okay, so these are examples of drugs which are given through the pulmonary route. Now let's look at rectal. Okay, I'm running out of space, so I'll just write it down here somewhere. The drugs which are administered through the rectal mucosal membrane. And in rectal, this is especially important to prevent febrile seizures in infants and children. Okay, so what is febrile seizure? Meaning, if we don't control the temperature, body temperature in infants or children, secondary to infections or some other causes, then it may lead to convulsions. Okay, it may lead to seizures. And what's the problem with seizures? It may cause brain damage in the infants and children. Okay, so that needs to be controlled, and for that, it's difficult to administer oral drugs tablets to children or infants. Okay, so in this case, what is preferred is administering the drugs through the rectal route, and in this particular condition, the drugs would be diazepam, okay, Valium, we know, diazepam or congener clonazepam. Okay. So these drugs are formulated as suppositories, and then they are administered rectally. Okay. Again, these drugs bypass the systemic circulation, and the bioavailability is slightly less than the sublingual route because from the rectum, a part of it goes into the systemic circulation, meaning it undergoes first pass metabolism. But a part of it bypasses the systemic circulation. Okay. Okay. The other thing to remember about infants and children is that their skin. Okay, so let me write it down here. This is a very important point. The skin in this children and infants, it is permeable. Okay, and we are comparing it to adults. It's more permeable to drugs than adults, and it is thin and it's hydrated. As a result, topically, if we administer some drugs topically, then it can have toxicities. Okay, so systemic toxicities is likely. Systemic toxicity is likely if drugs are administered topically to children, to infants, or children or both. Okay, in both children and infants, it can cause systemic toxicity. Again, that's the reason. And why? It's because the skin is permeable, thin and hydrated. Okay, so that's the point that we need to keep in mind with regards to infants and children. Yeah. Okay, so that's the examples of drugs which are given through the rectal route. Let's look at the drugs which are administered through the vaginal mucosa. Okay. And what could be examples of drugs? These, say, one, it's a dosage form like a vaginal ring, and through this device, drugs like medroxy, progesterone, acetate, norethindrone, or say norgestrel. Okay, these are drugs for contraception. They are administered vaginally. Okay, and these have got systemic effect. There are lots of other preparations which are used topically in the vagina. Okay, but we are interested in absorption from the mucosal membrane, and therefore this could be examples of drugs which are given vaginally for systemic effect, and they get absorbed through the vaginal mucosa. Okay, so we have covered the factors influencing absorption of drugs from the mucous membrane. And now let's look at some factors which influence absorption of drugs from the skin. Okay, so let's talk about factors influencing absorption of drugs from the skin. So the point to remember about the skin is the outer layer of the skin. What's the outer layer of the skin called again? Yes, the stratum corneum. Okay, so the stratum corneum is a barrier to absorption of drugs. Okay, it's a barrier. Okay, as a result, not all drugs can cross the skin, and under the skin, we got subcutaneous blood vessels. Okay, so there are blood vessels under the skin. So the idea is the drugs need to pass through the barrier, enter, and then subsequently enter into the blood vessels, and then go into the systemic circulation. But this process is not simple or easy because of the presence of the outermost layer of the skin, the stratum corneum, which acts as a barrier. Okay. However, if the skin is slightly hydrated and the drugs are lipid soluble, then they can get into the systemic circulation. And what could be the examples of such drugs? We have glyceryl trinitrate, say pesticides like say DDT, or the chemical warfare agents. Okay, so these happen to be like the mustard gas and so on. The organophosphorus war gases, okay, tabunsarin, soman, those kind of drugs. Weapons, chemical weapons, they can pass. They are highly lipophilic. They can easily pass through the skin. Pesticides like DDT as well. Okay. So yeah. So there are certain transdermal preparations. So the preparations which are meant to penetrate the skin and get absorbed, so those drugs are called transdermal. And there are other drugs which are formulated as transdermal agents like, say, scopolamine, estrogen, clonidine, okay, and the anti-addiction, nicotine patches. Nicotine, which are administered as nicotine patches, which is a transdermal preparation. Okay. So the another point to remember is that the skin, the absorption is more in the face. It's more where the skin is inflamed. And we alluded to if it is slightly hydrated. So it can be hydrated if we say give an occlusive dressing. Okay. Okay, so usually which contains petrolatum, the occlusive dressings. So it will retain the moisture, and if it retains the moisture, it would make the skin hydrated, in which case absorption would increase. And we can increase absorption by rubbing as well. Okay, and special case that we need to think about when we talk about skin is the point that we talked about earlier, that in infants and children, the skin is highly permeable and hydrated as a result. If drugs are administered topically, they may cause systemic toxicity in the infants or children. Okay, so those are the most important points that we need to remember as factors which affect absorption from the skin. Right? Okay. So with that, we have covered the factors influencing absorption from other sites. We have covered the injection sites, we've covered the mucosal membrane, and the skin, and that's what we set out to do with this lecture. Okay.